Well, right now, common medications are prescribed by doctors. Generally speaking, we treat diseases when they come up, and we treat numbers with pharmaceutical medications. Nothing against pharmaceutical medications, as long as they're used properly and correctly. My opinion on this is that all of us should maximize everything we can do naturally, and then if it doesn't work, then you can go to other medications, possibly if you need it. But I'm convinced that, and I've seen it happen, where patients are getting off these medications. I used to be on Lipitor. I'm off Lipitor. My ratios are better on this program. Had patients getting off both Lipitor and glucophage. Their blood sugar falls. They're off diabetes medicine. Their blood pressure falls right with all this. So if you reduce and shrink that visceral fat, I've lost 12 pounds of visceral fat. My blood pressure 100/60. Things are turning around for me, and I believe I'm going to reverse my coronary artery disease just like Gene did. And it can be done. But treating with these medications, treating numbers, I don't believe is the right way to go. I believe we should do everything we can naturally with supplements, proper nutrition, and avoid a lot of these medications. And unfortunately, from a financial perspective, so many of us are now having to bear the burden of our pharmaceuticals that companies can't afford it. I mean, people are on 10 medications. In my office, it used to be 2 and 3 medicines. I'm seeing 5 and 10 medications per patient coming into my office, and I look at that and I just think what the cost is. Someone's got to pay for it, and the health insurance rates are going through the sky, and that cost is going to be transferred to people. And when that happens, people are just going to say, I can't afford it. So I'm saying, let's get on this program now, do what you can to prevent it, start doing the right things, taking control and ownership of your health and your future, and not having to depend on pharmaceuticals. Comparative Guide to Nutritional Supplements, Lyle McWin. This is a very important book. You might say, well, okay, that sounds good, but why USANA? Why USANA supplements that I've been talking about? Well, I've done the research, and simply for me, and my recommendation, I'm putting my reputation at stake on it, is that I studied it, and simply USANA has the best product. And it's a tool to get to where you need to go. And Lyle McWilliam was commissioned by the Health Ministry of Canada to go and study supplements. Canada was interested in making sure that their people get good recommendations on what they should be taking for supplements. Didn't want them just taking anything off the shelf, and wanted them to be educated. So commissioned this study, and Lyle McWilliam went out and basically talked to worldwide leaders in nutrition and disease prevention, and came up with these criteria to evaluate a nutritional supplement. So these are the medically based criteria that are needed to look at a supplement for its quality, for things like bioavailability. Does it dissolve and get into the bloodstream? As well as, does this support bone mineralization? Does this support cardiac health, et cetera, et cetera? So this is a comprehensive test, basically putting each supplement through a very rigorous test for its performance. And what happened was they found USANA Essentials on a scale of 0 to 100 scored 96.1, and it was the highest of all. I listed these here because these have come from my audiences that say, what about this supplement, what about that supplement? And so here they are listed, and their numbers. The number 1 supplement in the world is Centrum, okay? And it's 3.2. So basically, with this, you're treating your mind more than you're treating your body. That, gee, I'm on a vitamin. So 70% of Americans are on vitamins. And they're feeling good about being on a vitamin, but they're not helping their body. And so it's important to get this out, and why I am up here in my recommendation. If you compare a table with USANA Essentials and Centrum, you can see the amount of the various antioxidants here is much less with the Centrum. And then the next slide, you can see that there is none of these very important components, bioflavonoids, choline, N-acetylcysteine, Q10, glutathione. These are very important medically documented supplements that have antioxidant and free radical scavenging components to them and properties that help to reduce the inflammation. For example, they operate in different places. Vitamin C operates in the liquid of your blood and the plasma. Glutathione operates inside the cell, vitamin E and choline in the cell wall. And so each of these has their own specific area in the body that they work on. Also, there's synergies between each component. For example, with the minerals, that certain enzymes require a certain molecule, a copper molecule, a selenium molecule in order to be effective. So having supplementation, say, of glutathione without the cofactor to go with it renders this less effective. So they potentiate and work together. When Dr. Wentz, founder of USANA, made these formulations, he was doing it based on sound research and experience. He founded Gull Laboratories in 1974, and by 1977 he patented the Epstein-Barr virus test kit, which is for mononucleosis. You've probably heard of that disease. And he became world famous as a microbiologist for developing this test, which is now and still used throughout the world, hospitals and clinics. If you have a mononucleosis test, it's his test. And by 1977, he achieved that. He left that particular company by selling his ownership in it because he wanted to get into disease prevention, because he had learned so much over the decades of growing cell cultures to grow his antibodies and antigens he needed to make his test kits. He knew what is needed to keep these cells alive, healthy, and free of degeneration. So he decided, he'd been in the disease diagnostic business and research for those years. Now he wants to move into disease prevention. That was in the late 80s, and by 1992 he founded USANA in order to have that vehicle to do it. Now his formulations are robust, high quality, but they're expensive. Okay, and so and Dr. Wentz, being a scientist, not a business person, decided that he's not going to compromise. When faced with the idea of you can't sell this at Walmart, Kmart, and these places because it costs too much, you won't hit a price point for the shelves to be on the shelves, and so he wouldn't compromise his formulation and decided that he was going to work with people and trust that the value and benefit of the product would work mouth to mouth by people referring. Word of mouth communication would be the way in which to reach the world with this product, and sure enough, it's worked wonderfully. So the product is high quality, and there's another product I want to talk about besides the essentials. The essentials are your micronutritional supplementation that helps put the inflammatory fire out in all the cells of your body, all the tissues of your body. The shakes is a separate concept, a separate product. The shakes are meal replacement shakes or meal supplementation shakes that you've got the USANA NutriMeal, USANA Soyamax, and USANA Fiber G. 3 different powders that are mixed in with water or skim milk or almond milk or soy milk, and you can make wonderful shakes, wonderful meal replacement shakes. I remember when I was first introduced to USANA through my wife, and we went to a meeting actually at the Only's place, and I became intrigued immediately when I saw this, that 9.5 grams of fiber, 19 grams of protein, and 23 grams of low glycemic carbohydrates. I said, somebody really smart is behind this company. I had been on a fiber drink that I was taking that had no nutritional value, only the fiber, because I know that fiber is very good. It has cardioprotective effects. It reduces your lipids and improves your cholesterol levels. And so I wanted to be on that. But when I saw this product, I realized I had a meal replacement because I wanted something that I could take simply and easily, that would be very quick and on the go. And so I was very impressed with this, and I've been on there ever since. The benefits of fiber: improved lipid profile, independent cardioprotective effect, lowers your blood pressure, lowers the glycemic index of your food, since the shakes, for example, have a glycemic index of 19. Associated with lower rates of hiatal hernias, appendicitis, diverticular disease, constipation, irritable colon, etc., and decreases the risk of colon cancer and breast cancer, as well as others. Cost comparison: someone might say, well, gee, how much does this cost? Well, let's have a look here. Big Mac fries and Cokes, $4.38. Okay. Starbucks, $1.75 for just coffee. A latte is $2.65. A mocha is $2.95, and a shake A complete 100% perfect nutritional meal shake is $2.20. So I have one of these for breakfast and one of these for lunch, 5 days a week, sometimes on the weekends. And my wife cooks a wonderful, highly nutritious, low glycemic meal for dinner, and that's my program. The advantages of the shakes: great taste, perfect nutrition, convenient, prepare in advance. I freeze my lunch the night before and I take it. It's thawed out by lunchtime the next day. There's flavor choices, 3 components depending on your needs. You can emphasize fiber, you can emphasize the protein. They're versatile and they're used for weight loss, for simply weight maintenance, enhanced muscle mass, and overall excellent nutrition. So my daily plan, I have my breakfast shake with some omega oil in it, which is the right mix of omega-3s and 6s, low glycemic carbs, high protein, high fiber, low fat for breakfast, then the lunch with, again, the shake, plus or minus a fruit or a salad, and then dinner. You want to have plenty of food for dinner, but the right food. This is not a starvation diet. This is a program for a lifetime that you can stay on and enjoy long term. Salads, low-fat meats, vegetables, fruit, as much as you want here for dinner so you're not hungry. And on this program, your carb craving goes away because you've moderated your glucose cycle during the day and you're not spiking and you're not going hypoglycemic, so that you're on a nice, easy wave there during the day and you don't have that carb craving. I'm not nearly attracted to high glycemic foods like I used to be. And many, many other people said that. It literally breaks the carbohydrate addiction cycle. So why USANA? I just simply believe it's the best tool out there. I've done the research. Certainly there's other ways to do this if you like, but this is my recommendation. Dr. Wentz is such a credible scientist that his product formulations are right on target. His products really work, all the way to the phytoestrogen for hot flashes and menopausal symptoms, and Procosa for osteoarthritis and joint pains, and many others. We have so many testimonies. Now when people come to me and ask me, what can I take for this, or should I take that, I help them because so many have come back and said that this has worked for them. So I try people on all the products of USANA, seeing so many benefits. It's definitely worth doing. And the second thing is the independent verification that the products hold up under scientific scrutiny for composition and potency. Take-home messages today. The decline of American health correlates with the rise of the convenience food industry and the carbohydrate addiction cycle. It's the #1 cause of the overweight epidemic. Coronary artery disease and other inflammation-based diseases can be successfully treated with proper supplementation and nutrition. And the medical literature clearly supports everything I've been saying here today, 1,300 medical studies. And the knowledge you have here today hopefully will go with you and hopefully give you the power to change. Because when you know this, it's a lot easier to make the changes. And again, that this is a marathon, not a sprint. That you want to make changes in your lifestyle that you can do every day the rest of your life, things that you enjoy and you like and you get used to. And this program is so flexible that you're able